For very many years, it's been treated as a neurological condition with medications, which are a lot of them are anti-seizure medication, and only when things don't work as well, the dosage is increased, and you're pretty much on it for lifetime.
Welcome to Nice Legs with Dr. Kamran, the podcast dedicated to leg health. I'm Amy Bowen, the show's producer, and in this episode, we're taking a closer look at Restless Leg Syndrome, a condition that's long assumed to be neurological. But what if it's not? It's estimated that 7 to 10% of people in the U.S. are diagnosed with the condition, but up to 40% of the population has venous insufficiency. Here's Dr. Kamran to explain why those numbers matter and why restless leg symptoms may actually start in the veins.
Well, thank you very much, Amy, for joining us on this podcast, as always. I'm, vascular general surgeon. I deal with a lot of vein disease. So you might say, why am I so interested in restless leg syndrome? I've been doing this for over 20 years. And I found out that over time, a lot of my patients who quote unquote had restless leg syndrome were getting better or getting cured after we treated their venous insufficiency. I still remember one of my patients, this is almost 10 years ago, said, Dr. Kamran, my restless leg is gone. I'm so thankful. I'm actually off my medication, and we'll talk about this a little later. So having found that out, and you and I did some literature search, so when we looked at the Cleveland Clinic, National Institute of Health, and we looked at Johns Hopkins, when you go online, you Google restless leg syndrome, is very little mention of a vascular component that should be in list of your differential diagnosis. So that was a red flag right there. When we think about restless leg syndrome, why don't we think about that? And the physicians have gotten more and more specialized, and we've gotten busier and busier. So you go to your primary care physician, you say, I'm constantly moving my leg and can't sleep at night because of restless leg. And the doctor says, okay, let me send you to a specialist. So now, without getting too much more history, the patient is sent to a neurologist. And the neurologist, it's been a long time since they started looking at the venous insufficiency and arterial disease. You end up automatically assuming that this is all neurological and try to treat them. So the whole purpose of this podcast and the next few podcasts is going to be, if you have restless leg syndrome, let's look at it very critically and see, is this a neurological condition? Is it neuropathy, or could it be vascular? And could it be a combination of all? Because usually most things are a combination. For example, just you mentioned earlier, 7 to 10% of the population have restless leg syndrome. Now, we also know that it depends what you read, 35 to 40% of the population have venous insufficiency. So if you walk into my office and you say I have restless leg syndrome, the odds are, if I thought about venous insufficiency, I have a better chance of making the right diagnosis than just calling it restless leg. So we've got to start thinking very critically, especially patients who have treated for a long, long time. We've got to go back and start revisiting our diagnosis. Is this indeed what they have? So I hope that at the end of this conversation today, if you could only raise awareness about restless leg syndrome and what does it mean and what does a diagnosis mean, then I think, we certainly have achieved our goal, which is to help the public as much as we can through this podcast. The essential diagnostic criteria for restless leg syndrome from International Restless Leg Syndrome Study is that you require all 4 symptoms. Number 1, urge to move the legs. Symptoms begin or worsen during rest. Sitting, lying down, or long travel makes it worse. You should have relief with movement, walking, stretching, or leg motion, at least temporarily. It also says there's a predominance of it happening at night and evenings. Now, if you look at the symptoms of venous insufficiency, pretty much all the 4. Usually they get a lot worse at night when you're on a plane ride because of negative pressure in the airplanes. A lot of people complain about leg swelling in the leg. Patients say that their cramps or restless leg is a lot worse at night. And when they move, it gets better because when you move, your calf muscles move, which is a pump for your venous insufficiency, pumps the blood out and you feel better. So is really, I would argue that those four symptoms, which is supposed to meet the main criteria for restless leg syndrome, are also identical to what you see with venous insufficiency. So you say, okay, that Kamran, great. So how are you going to make a diagnosis? Well, I would start off by, first of all, asking those questions a little bit more critically. In other words, let's dig hard. Do you also get some swelling in your leg? Because restless leg doesn't cause swelling. Do you find that when you wear compression stocking, you don't have as much restless leg? So that should start making you wonder, is it venous insufficiency or restless leg? And so that is just certainly a good start. But then every diagnosis, whether you're a neurologist or you're an internist, you take a history, then you have to do the physical exam. Look at the patient's leg. Patients can look at their own leg. If you have restless leg, look at your own leg. If your ankles are all swollen, or you've got some veins pushing out, or you've got hyperpigmentation, which is dark discoloration around the ankle, or you have ankle flares, which is like a spiders around the inside of your ankle, or if, for example, you have venous dermatitis, where you have a rash, you have itching, uh, maybe you start thinking about even if you have pure restless leg, you also have a component of venous insufficiency. So, with that in mind, I think the next stage usually, if you went to a neurologist, is that they try to do a sleep study and they try to measure your iron level because it's been shown that serum ferritin level should be more than 50 to 75 nanograms per milliliter, and if you or obviously have less than that, one should consider you have restless leg syndrome, or at least confirms the diagnosis. And also, even if I've got a normal hemoglobin. Again, I don't mean to get too clinical. I'm hoping that my colleagues, both in neurology, internal medicine, primary care physicians, surgeons, are listening to this. I think we all have a lot to learn. Don't just go with one diagnosis. Always remember, human body is very complicated. Always think about other criteria. So, going forward in our next episodes, I would like to invite my family nurse practitioner who was in clinical medicine for a long time and neurologist for a long time to be a guest. So now that she's been working with me, taking care of venous insufficiency and vascular condition, she's been in both camps. I'm hoping all the people out there, and I know there's plenty, who are throughout the world, who are suffering from restless leg syndrome. Hopefully, help is on the way. Hopefully, through education, which is what this podcast is about, we can educate not only you, but also your physicians who are treating you to look at more critically in your diagnosis and your treatment and make sure we don't stay in that bubble. We reach out across the aisle and look at other specialties and see if they agree with our diagnosis or they can contribute in making the diagnosis. The biggest problem, I think, in life, if you ask me now, having been in medicine for, God knows, almost over 40 years, invariably it is not the doctor or the treatment, it's the diagnosis. If you don't make a right diagnosis, doesn't matter how great your treatment is, you're not curing the patient. So start taking an adequate history, do a proper physical exam, reach across the aisle, get opinion from other physicians as well. And if you feel it could be neurological, obviously get them involved. If you are a neurologist and you think it could be vascular, get them involved. And at the end, when we all do what we're supposed to do and do it the best that we can, hopefully our patients will not suffer.
I think the interdisciplinary approach, bringing as many brains into, solving these puzzle pieces, putting the whole picture together is something that patients really appreciate. For me, on the patient standpoint, that's something I think is such a interesting piece of the equation in medical discussions that are taking place now, especially in podcasts and things like that. Obviously, it's best to work with your physician to uncover these things instead of trying to use Dr. Google to diagnose. But there is real value in patients really taking an accurate, uh, record of your symptoms, tracking them. That's been the game changer in those conversations when they're connecting with their physicians. So, with restless leg syndrome in particular, if more patients know the possibility of restless leg syndrome symptoms also being a similar constellation of symptoms for vein disease, that does arm them with a little bit more knowledge to be able to just enter that as a talking point into their next discussion with their physician too. So,
Absolutely. And, there's one thing we didn't talk about. I know we've talked about anybody who's listened to our other podcasts, and I strongly urge our audience to listen to our podcast because we've talked about venous disease for a long time. It is now pretty much a very easy way of treating it. You don't have to go to the hospital. There's alternative to an IV. There's no cutting, no stitching. There's no pain afterwards. So it's so much easier to treat it and much less riskier. So why would you withhold the treatment, which is so easy on the patient that you can do in an office setting, if indeed that's going to help the patient? What about the cost? When medication is expensive, and if you're on medicine for the rest of your life, just do the math. How much is it going to cost you for a medicine that you didn't even probably need, or it wasn't even necessary? And we all are on some kind of medication, and now you're adding some seizure medication, and you're adding more and more. So these drugs are not exactly without risk. And then as we get older, our kidney and liver doesn't work quite as well, so you can build up a toxic level of the medication in your body. And why? When something could have been helped just by making the right diagnosis. I often tell my patients, I said, when you withhold information from your doctor, you're really hurting yourself, because your doctor is only as smart as what you tell him. So when you don't tell him everything which is wrong with you, or as much of it as you can, and describe it, it's not just I have a pain in the leg. What kind of pain do you have? Is it a stabbing? Is it cramping? Is it at night? Is it at day, during the daytime? Because all those things allows you to make a diagnosis. So when you say I've got leg pain, the doctor automatically thinking about, could it be musculoskeletal? Could it be venous? Could it be arterial? And the next thing you say, well, it only hurts when I walk. So now he's taking more arterial. And then, so the more you tell him, and sometimes I like a compression stocking is both diagnostic and therapeutic. So if you think you've got venous insufficiency, or you think your restless leg is caused by venous insufficiency, keep a compression stocking. That does nothing for neurological condition. But if you put it on and your restless leg gets better, you better start thinking, could this be venous related? Now, let's say you got restless leg, you've also got arthritis, you've also got vein disease. You put the compression stocking, doc, all my pain is gone. Doc, you've already made diagnosis, because that's the only thing the compression stocking is doing. So it is a more convoluted, and we love to do tests. Let's do a CAT scan, and that's supposed to tell us everything. Wrong. The majority of diagnoses are made on history and then a good physical exam and the test. For example, if you're a neurologist and you say you've got restless leg syndrome, they're assuming everything else is being checked, which is fine. So you don't even hopefully need to go there if somebody looked at your leg and said, man, you've got every indication to have venous insufficiency. Before you start doing a sleep study and measuring your ferritin level, let's look at these two other conditions, see what's going on. As I said, this is almost sounds like a monologue, because I'm looking at it through the angle of a vascular surgeon. Going forward for our next few episodes, we're going to have neurologists and other experts seeing it from their angle. And at the end, you, the consumer, is going to be the sole beneficiary of it, because you're going to hear all these opinions and you come up with your own conclusion, because still medicine is more art than science.
well, Dr. Cameron, before we conclude today's episode, for patients, if they are currently being treated for restless leg syndrome, or if they suspect they have restless leg syndrome, what should they ask their physicians if treatments haven't helped so far, or if just general symptom relief suggestions haven't helped so far?
That's a very good question. I think the most important thing is be very honest with your doctor. Don't worry about their feelings. Trust me. They will appreciate that. Say, doc, could it be another diagnosis? Could this be vascular? I don't mean to be funny, but I'm going to be a little funny here. You could say that I just listened to this podcast by Dr. Kamran, and he says vascular, venous insufficiency could be a cause of it. Doc, do I have venous insufficiency? Do you think you could send me to somebody who understands venous insufficiency can run tests to show, for example, an ultrasound that they have venous insufficiency. So I honestly, I'll always encourage my patients to get another opinion, because unless we are perfect, and there's no such thing as perfection, we could not, it's quite possible that we are wrong about our diagnosis. And that's why you always got to encourage the patients to question you, be honest with you. Don't tell your doctor, hey, no, this is working great for me. It's not about his feelings, it's about your health. They will appreciate the fact that you're questioning that is the treatment working or not. Getting a little bit better is not the answer. And always ask the doctor, am I going to be on this medicine for the rest of my life? What are the potential dangers of this medicine that I'm on? What is the potential risk of interaction with all these other medications that I'm on? So ask those critical questions and get yourself educated. Have a patient advocate. If you have a friend who's a nurse, a doctor, PA, Google. Educate yourself, because your health depends on it.
Thanks for listening to the Nice Legs with Dr. Kamran podcast. The conversation doesn't end here. Next, we hear from neurological experts to dig even deeper. In the meantime, follow and subscribe to the Nice Legs with Dr. Kamran podcast on YouTube, Spotify, Apple Podcast, and wherever you listen. Or visit scarlessveincare.com/podcast.